Hey everybody, Mike Reed here with Safe Solutions. I'm here today with Sharmaine Lonsworth with Physiophyx Physical Therapy. How are you guys doing today? We're doing our community spotlight. We wanted to run through a couple questions to ask Sharmaine. So what started your business? What inspired you to get going?
Yeah, so we moved recently from Illinois to Texas, and I used to do virtual therapy for people here in Texas while I was there in Illinois, and I noticed that some people are not getting enough care over here. Listening to my patients before, like how like they're not getting one-on-one treatment and stuff like that, and like coming from the Philippines, like my dad had a stroke there too, so I was able to help him out. Me and my sister were he's able to recover from that. So it's really life changing for us. So I want to share that while moving here to Texas.
Awesome. So obviously there's a lot of physical therapists out there. What makes your clinic different from most other physical therapy clinics?
Yeah, so what we do at our clinic, it's all like one-on-one treatment sessions, so we don't pass patients around to whoever. So if you are my patient that time, you're there with me the whole time for an hour, right? I'm listening to you, and it makes a big difference because patient feel heard, and we were able to kind of like identify what's really going on with them without me rushing, and then they feel more relaxed and comfortable with me. So I'm able to get that rapport with them. I'm able to get to know them and what their symptoms are. So that, and then with that 1 hour therapy, we divided into half. So half manual therapy. So that means like a lot of hands-on treatment with them, some just short points. And then the other one would be doing their exercises as well. And then we're updating that each week depending on how they feel. So
Okay.
that's how we are different too, because each week they be upgraded, and we only see them once a week instead of 3 times compared to other clinics. So they have
Yeah.
more time with their clinics. That's how we are different.
Okay. So it's not just coming in and doing a bunch of exercises with
Correct.
nobody watching you or helping.
Yeah, exactly. Yeah, and we offer dry needling services, shockwave, and we have ultrasound imaging for patients who are like, I don't know if I have a tear or not. Can you check? So
Yeah.
we can check in real time.
Okay, awesome. So, who do you typically get in your office, and what kind of results can they expect?
Yeah, so usually a lot of active adults, either so that chronic pain patients that we have, they like to work out a lot, but they're having this symptoms. Let's say I had a patient that has knee pain for 15 years, it's hard to lunge and stuff like that, and she went to different clinics, but they didn't get better.
Yeah.
So those people, they're very motivated. So all of our patients are highly motivated, and they're followed through whatever we plan for them, and they get good results because of just how motivated they are and stuff like that. So yeah, chronic pain and then active adults as well.
Okay. And what is one patient story that's really stuck with you over the years?
Okay, so I had this patient when I used to do like a home health before. I had a patient who had a stroke, so all her left side is paralyzed, no movement at all. She was bedridden when I saw her, no movement. And then we work on rolling the bed, sitting, rolling to sitting, sit to stand, and then so she's finally able to walk. That's awesome. Doing her first step is really critical, for her. The whole family and me and everybody just cries. So like it's like so normally with traditional physical therapy practice is just like a little dumbbell, like 1 to 10 pounds and just a little band and stuff like that. Our equipment is more advanced. So we have like power lifters, we have like athletes at the gym. So definitely got more equipment that they do. So just more high level patients and more preventative. We have some patients that want to prevent injury. Yeah. So definitely they're already strong. So we're just trying to like make sure that they don't injure themselves in the future. That and then like what I told you about, we have imaging as well. We have dry needling. We do a lot of hands-on work. We do visceral manipulation as well because we believe that our viscera is connected to the whole body. So we also kind of do that at the clinic, but other clinics don't do that. It's mainly just exercise here.
And so you guys follow more of a full body approach. So what makes that different, or why do you think that root cause healing is more important?
Yeah. So even though a patient came from, let's say, a shoulder pain, we do like a full body exam because we don't know, maybe that shoulder pain came from somewhere else. It could be the neck, it could be the thoracic area. If there's limited on this area and I'm not able to fix that, I'm not going to be able to help the patient. So it's important for us to look at the whole body, and then also if the patient's sleeping enough, are they eating well enough? Those are also like the things that we talk about to our patients, like kind of like into their whole wellness, just to make sure that they're better.
Okay. And then, so how do you help people recover faster? And you said active adults maybe avoid having to have those surgeries.
Yeah, so what we essentially do, aside from the full body approach, like listening to them, and then also make sure that like we're available with them like 24/7. If a patient got injured, they can access right away without a longer holding time. Like if we call someone, because sometimes they're on hold for an hour. We don't do that. If a patient messages, we try to help them right away, direct them to the care they need. If, let's say, if they get injured at the gym, it's either they come see me, if it's worse, then I have to refer them to another healthcare practitioner that specializes in that. So we're able to help them out like right away with that time frame before it gets worse.
Okay. And what motivates you to keep going and doing that every day?
Oh, well, my family, of course, like my husband, my kids, they're at the clinic, and then they help build us up, so they're always there. It makes us keep going. Like, hey, this is why we do these things. But also the patient, it's just the changes that happens to them. Like, hey, I'm able to get up from the toilet without having pain. I'm able to sit down again. I'm able to without hurting my back. Like, I'm able to walk now. Those things to be here every day makes a big change for sure.
That's all right. So, other than that, how can someone get started? Where are you guys located, and what do they do? Next steps if they're interested in getting going?
Yeah, if you guys are interested, our website is www.physiophyx.com. So physiophyx.com. You guys can put your name in there. They can put their information and they can schedule a call, and then we'll call them right back, or they can call us.
Okay.
And yeah, it's really easy. Even on our Google, you press the link and then it'll lead you there and put your information, and we'll give you a call and talk to you.
And again, where are you located?
We're in Saginaw.
Awesome. So if you guys are ever in Saginaw, or if you're in the area and you need physical therapy, you want somebody who's not just going to give you a list of exercises to do and then leave you on your own, definitely recommend reaching out to Sharmaine and her team over at Physiophyx.
Yeah, thanks, Mike. And this is Mike from Safe Solutions. He's the best. If you guys need all the security solutions, he's there with you guys. I appreciate you guys.
Thank you. Have a good day.